Hello everyone, how are you? It's Dr. Splickle, Functional Podiatrist and Human Movement Specialist. I am here to speak to you about one of my favorite paddings to be used on the foot. And this is going to be a scaphoid pad. Now, a scaphoid pad is something that is designed to support the navicular bone or the medial arch. And an interesting fact is that another name for the navicular is actually the scaphoid bone, so similar to the wrist. So the scaphoid pad, again, is designed to support or mimic the support that we would get in a custom orthotic. Now, there's several ways in how I will use a scaphoid pad. Either I will use it to go into minimal shoes to build support along that medial arch in someone who maybe has a little bit of ligament laxity around that navicular and the medial column, so that I can bring support to the minimal shoe or to the shoe without getting a whole stiff shell and custom orthotic built into it. If that's the case, you will do very similar to what I'm going to show you shortly on how to place it in the appropriate place. Now, the second way that I like to use a scaphoid pad is actually on a custom orthotic. Now, sometimes when you get a custom orthotic, the patient or the individual will say, well, this feels good. However, I wish I had a little bit more support. I feel like I'm still falling in. I feel like I'm still working a little bit harder, or it's not relieving all of my post-hip issues or my plantar fasciitis. So what I will say, tell the patient, guess what? I can make that orthotic more aggressive or more supportive, but before I send this back to the lab, I'm going to test it out with a scaphoid pad to see if that's what you need. Do you need a little bit more aggressive medial arch to support your unique foot? So to find the appropriate placement of the scaphoid pad on the custom orthotic, that is what I'm going to show you now. So what we're going to do is you're going to take the custom orthotic and the scaphoid pad, and we're going to find our arch placement. So I have a left orthotic, and what we're going to do is we're going to set it onto the floor. You're going to stand on it. Now, this is not my orthotic, so please note it is obviously larger than my foot size. You're then going to take the scaphoid pad, and we want to place it underneath the foot. Excuse me, let me rotate that. We want to place it underneath the foot so that it is located not underneath the heel bone and not underneath the first metatarsal head. So that placement is really important. Now, why I like to confirm the placement of the scaphoid pad while standing on the custom orthotic is because everybody's arch and the height through the navicular is unique to our own foot. That's partly why custom orthotics are really important. And what I'm going to do is I'm going to place it and see how I feel. If I go a little bit, let's say too far back, do you see how I'm now actually kind of standing on the scaphoid pad? That's not comfortable. That might actually give me plantar fasciitis. So I need to move it forward a little bit and then find that placement. Now, if I have it too far forward that I'm under my first metatarsal head, well, that's not good either, because that could give me sesamoiditis. So I'm gonna place it back a little bit. I'm gonna find my navicular, and let's find that placement. So I'm going to be here, and I will say, okay, this feels comfortable. It's not underneath my heel. It's not underneath the first met head. It's right where I can see my navicular. This feels comfortable to me. And then I will mark the insole or the orthotic, and then I will peel off the sticker that's on the back, and I will show you exactly. There's a sticker on the back of these, and then I'm gonna place it on top of my custom orthotic. So I'm gonna place it here. Now, if you look at a scaphoid pad, this is one that I cut out of felt, but you can buy a scaphoid pad and they're usually a little bit bigger. So when you see them, you actually want them to be slightly hanging off of the edge of the orthotic. Now you might be wondering, well, why would I do that? As soon as you put this into your shoe, this part of the scaphoid pad is going to wrap, let's see if I can show you, do you see that? Wrap along the edge of the shoe. So a scaphoid pad is actually a combination of a support to the medial arch with a little bit of a medial flange. So as soon as you have that, you can see the little wall this way. Do you see how it's going to act like a wall? That is called a medial flange. So using the scaphoid pad on a custom orthotic to give a little bit of an extra lift to the medial arch and the navicular also can integrate a little bit of a medial flange to support that spilling inward that can happen with a navicular or a post-tib tendon that's getting a little bit weaker. So scaphoid pad placement on a custom orthotic, that is how you want to find it, unique to your foot. Please do not just take the orthotic, take the scaphoid pad, and think, that looks good. That looks like my arch. You want to make sure that you are standing on the custom orthotic to find your appropriate placement. You will do the exact same thing in your shoe. So if you are putting the scaphoid pad into your shoe by itself, you want to be doing exactly what I just showed on that custom orthotic. Put your foot in the shoe and make sure it's not under the heel, it's not too far forward. Make sure that you're wrapping it along the side of the shoe to give a little bit of that flange and that medial support, just like a little wall so that it can't spill down. If you are looking to get a scaphoid pad, I always recommend a 1/4 inch felt. You could simply go to Amazon.com, search scaphoid pad 1/4 inch felt, and there you go. If you want to learn more about functional podiatry, please visit my website, dremilysplickle.com, and make sure you follow me on Instagram at dremilydpm. Take care.